we are now coming to the panel discussion, because the question is, how should we discuss, how should we approach this public discussion? It's not an issue which one profession can lead and spearhead. It will not work. So we are coming to the panel discussion. I would love to invite Kerstin and Dr. Lori Dagencourt to come and start with inviting the members to give statements and really open up for a collaborative discussion with you all. No position to it.
Dr. Lori Dagencourt Canning is an ethicist and director of the Clinical Ethics Service, BC Children and Women's Healthcare Center. She's an assistant clinical professor in the Department of Pediatrics, UBC, and is cross-appointed as an adjunct professor with the UBC School of Nursing. She has a key role in clinical and organizational ethics consultation, as well as ethics, education, and capacity building. Her research focuses on social justice and access to healthcare. She also has a keen interest in the ethics of multidisciplinary practice, moral distress, and the moral climate of healthcare. I don't think we could have a better person to help moderate this discussion. So just before I introduce Dr. Dagencourt Canning speaks, I'd like to invite the panelists to join us up on stage.
Hi, I've been asked to help facilitate this panel discussion, but as I was saying to Kirsten beforehand, she's doing such a marvelous job. I don't think I really need to. But at this point in our discussion, I think we want to move forward a little bit, and we're talking about some of the scientific aspects of sleep disorders. We've got new knowledge about how sleep disorders are particularly prevalent in kids with neurodevelopmental conditions and with some of the genetic disorders and so forth. We've also heard people talking about the need for interdisciplinary practice and interdisciplinary approaches to these disorders on sort of like a medical and healthcare level. But it's at this point, I think we can really turn to parents and to provider groups and so forth and say, and begin to ask questions about what are your needs and how do we collaborate in different kinds of ways than we have in the past to start to address some of these gaps, both in research and in care and providing parents with what they need as well. And then just sort of start, how do we work together to create and to operationalize this and to move it on to a sort of a different way of thinking about research and working together. So at this point, I'll just stop, and I guess it's up to each of the panelists now to take a few minutes to just, present on what you've heard so far, or your thoughts on what you've heard so far.
So the idea of bringing the panel together was to have a cross-representation of parent groups and practitioners within the community, as well as clinicians. So I'd like to start out with Lori Eisenhauer. Lori currently serves on the board of directors for the Rare Disease Foundation and is the co-founder, research and developmental chair for IDIC 15 Canada. She has both clinical background as a respiratory therapist working with people with disordered sleep and a unique perspective of living with a child with an idiocentric chromosome 15. Sorry, Lori. This means living with a complex neurodevelopmental and medical needs, including disordered sleep. The underdiagnosis and treatment of disordered sleep in children is living with IDIC 15, as well as other children living with complex medical needs, is a personal passion. So Lori, I'm hoping that you can just provide a comment and a perspective from the IDIC community on what your needs are and some of the possible solutions that you see.
I guess, it's interesting to hear everybody speak tonight coming from different perspectives and, looking at it mostly from a parental point of view. In the IDIC 15 community, dealing with multiple complex issues like intractable epilepsy and autism diagnosis and things that are always in the forefront. Even myself, who has experience in disordered sleep, it took me a long time to recognize that need in my own child, because other things become very much in your forefront, or more what you consider to be more emergent. In our community, we often talk about, in our online communities, about sleep deprivation and chronic sleep disorders in a very general way, but very few people recognize it as a need to bring up when they see their clinicians. You have your top 5 list and you're trying to get all of these things addressed. You're chronically sleep deprived and you don't really know that you are, because you're going through all of these other things. So I think in our community, we have started to raise a lot more awareness, as this is a very vital component and something we should be looking at a lot more, and looking at our children's overall health. And I had a great conversation with Dr. Sprite. Like, if you think about these things, what is this doing to my child's epilepsy? What is this doing to her ability to learn under her autism diagnosis? Because we haven't sorted out her disordered sleep. So I think it goes along the lines of Autism's point of view, and how we're treating a whole person. We're treating a whole person, and the outcomes aren't necessarily measured by what numbers you hit in certain tests or certain evaluations. It's about the whole quality of life. How happy is my daughter? How is she learning? How is her epilepsy? How is our family functioning as a unit? Because I mean, there have been times in her short little journey at 3.5 where we have been so sleep deprived that I put the phone in the freezer. I do things like that often, and that's not who I am. So, it becomes a very progressive situation. And I think that this is a wonderful opportunity for us to raise awareness on so many different levels about how important it truly is. And I feel very grateful to hear all of the perspectives presented today, and I think it's a wonderful start.
Thank you, Lori. I'd like to ask Wanda Schellenberg to present next. Wanda is a parent of a child also with a 5P- syndrome, a genetic disorder that involves global delay, vision and hearing impairment, and sleep challenges. She is also on the board of directors of the Canadian Deafblind Association and is involved with the Rare Disease Foundation's Parent-to-Parent Resource Network, a group that holds cross-disease information sharing and social support.
I think I would like to reiterate what Lori said. So, but also, I mean, you expressed that parents often are overwhelmed with a whole series of quite serious health issues, and frankly, I think, from my perspective anyway, and the few parents I've talked to, there's often a difficulty just recognizing that there is a problem. We're often, have our top 3 or 4 others kind of serious health issues going on, and we don't necessarily see that the sleep problems could be related or integrated with those. And my daughter is 16 now, and I can't actually recall ever being asked by a doctor or a clinician about her sleep problems. So, I think that awareness issue is right at the top of the list there.
Thank you. Next, Dr. James Reynolds is a professor in the Department of Biomedical and Molecular Studies in the Center for Neuroscience Studies at Queen's University in Kingston, Ontario. Dr. Reynolds has been engaged in basic and clinical research on fetal alcohol spectrum disorder for many years. Dr. Reynolds is the project lead for the FASD research program in NeuroDevNet, a national network of centers of excellence that focuses on children's brain health and development.
Thanks, Kristen. It's a pleasure to be here. I come from a very different perspective. I'm not a parent of, I am a parent. 2 kids who would probably sleep around the clock if they were allowed to. But I'm not a sleep researcher. I'm a researcher that will focus on FASD, but I've never been engaged in sleep research. I'm not going to become engaged in sleep research, but I'm going to promote it because it is a substantial problem in the population of kids and their families that I do work with. really became sensitized to this probably a couple of years ago at a meeting in Winnipeg when one parent made it very clear that, and underlined by a number of social workers, was that the number one reason for breakdown in family placements of a child with FASD were sensory processing problems, and sleep was right at the top of that list. So these are kids who are getting bounced around from home to home to home because they have a sleep disorder that's disrupting that home experience. Well, we can all recognize that sleep problems do have a negative impact on development. If you live in 15 or 20 or 25 different houses between the ages of 0 and 10, that's going to have a pretty negative impact on your development as well. So we need to address the problems in this population. And actually we found within the network that, as I'm sure all of you know, sleep problems are common across multiple neurodevelopmental disorders. So this, within our research network, has become a focal point of bringing people together from different areas of research and different expertise to tackle what is a very, very common and substantial problem in the different patient populations that we work with. So that's why I'm here.
Next, I'd like to move to Christine Hung. Christine works with families and can offer another perspective as well. Christine's an information officer at ACT, the Autism Community Training. She's supported many parents of children with autism spectrum disorder over the past 5 years and has heard countless stories of families not able to function normally because of their children's sleep problems. Christine is also a parent of a child with autism, so she brings a unique perspective.
Yes. I think for us to approach this problem, we need to really, just like treating autism, we need to have a multidisciplinary team, not just someone from my own experience. My daughter has an OT who focus on sensory issues. The pediatrician focus on how I can use medication, and behavior consultant will talk about how we can approach this from a behavior point of view. But as a parent, as a family, we need a really holistic approach. We need professionals to come into our place and really do a functional analysis of how we actually face all this challenge and how you can help us. So first thing I really want to stretch is the multidisciplinary team. And then another thing about bringing awareness, I think not just focus on Ministry of Health. We need to bring awareness through Ministry of Health, Ministry of Children and Family Development, and Ministry of Education as well, through the school system as well. So that's my 2 point of view.
Thank you. Dawn will be able to offer us an interesting perspective from the neurodevelopmental disabled children working with the Down Syndrome Research Foundation, a not-for-profit organization that provides effective educational programs and therapies for the Down syndrome population. She also is on the executive committee for the IASSIDD, that's a mouthful, Down Syndrome Special Research Interest Group, and a member of the Scientific Advisory Research Group for the Down Syndrome International. Dawn has a business background and is passionate about improving health and educational outcomes for individuals with Down syndrome.
Hi. I was really delighted to see some of the information that Dr. Sproit provided in her presentation. One of the things that struck me was 67% of children with neurodevelopmental disabilities have sleep issues. I think in the Down syndrome population, it might even be higher than 67%. Physiologically, they have complications and a host of other reasons. In the Down syndrome families with Down syndrome that we talk to, sleep is not high on the list of priorities. There are so many other things that they're dealing with. Feeding issues, toileting, walking, speaking, communication, and then transition to school. I mean, there's just one thing after another, and they're advocating for the kids all the time. So sleep is not high on the list. In the US, the Down syndrome Medical Interest Group has recently updated the healthcare guidelines, and they recommend that as early as age 4, polysomnogram is done for all kids with Down syndrome. This is not something that is recommended by the Canadian pediatric community. It's something that we would like to bring more awareness to, that there are sleep issues in the Down syndrome population. I think awareness is going to be key amongst families as well as professionals, and a multidisciplinary approach, as has just been mentioned, I think is very, very important. So our role is going to be helping to bring more awareness to this moving forward.
Thank you. We're going to conclude with a comment from Dr. Julie Petrie Thomas. She's a developmental specialist in the psychology department at BC Children and Women's Hospital with particular expertise in prematurity. She's also the current president of Western Canadian Association for Infant Mental Health, a multidisciplinary group of professionals whose mission it is to promote education, research, and study of social emotional development during infancy, facilitating optimal psychosocial functioning.
That's a mouthful.
Yeah.
I'll first talk about my role at the hospital. I work full-time in the neonatal follow-up program, where I have a clinical role in assessing and following children born that have graduated from the NICU. So mostly kids with prematurity, some kids with congenital heart disease, and so on. I'm not seeing a lot of children in that triangle. I'm aware of them from other jobs I've had and so on. But just from the perspective of a clinician who has a busy schedule of getting kids through the system, doing your assessment, and trying to do a cognitive assessment, a behavioral assessment, and any other information that you need to do, transition to school and so on. With a 4-year-old, you've got 2 hours to do that. Then you've got an hour to collate those materials and provide feedback to the family about half an hour later. So is sleep on the agenda? Not really. It's on one questionnaire that I give, and I may even score that after I finish seeing the family. And unless there are significant issues, I may not even refer to it in a 3 or 4 page report that I write a few days later. So I think we're hearing consistently across the board that clinicians don't regularly ask about sleep, and that is probably very true of all of my colleagues. I ask about it more since it's been on my radar. And I'm also very interested in executive functions and attention. That's my area of research. I have tracked executive functions and attention at 8 months in infancy. I have a measure in premature children born very prematurely to 8 years. So executive functions are difficult to measure, but you can measure them. And there is I have longitudinal data showing that we can look at infant, integrity of brain. I always think of executive functions and attention as telling me a lot about the integrity of brain. And I always tell parents also when I see, because I see a lot of 3 and 4-year-olds, is that you have, and I loved Karen's presentation from this perspective, because she really emphasized the relationship between development and sleep. To me, I think that was the most kind of interesting aspect that I got from her talk, because you have this incredibly rapid brain development that continues from birth and really doesn't slow down really dramatically until about 3.5, 4. And so all of that period of time when when children are getting into their regular routines and so on, you've got this this connection between development and of course sleep is a big factor. Now I always tell parents as well that when you have a baby that's born with a vulnerability, which are all the children I see, that's why I see them, because they're at risk of problems in neurodevelopment. They're graduated from the NICU, we recruit them and we test them to see how they do. And I always tell parents that how they turn out, there's a lot of very positive research now on sort of the malleability of the brain, how we're developing, it's not all, it sort of goes on. And surely if sleep is such a powerful regulator in terms of helping development and improving the quality of life, not just the child but the family, I mean, we really should focus a lot more on it. And executive function and attention are comorbid with practically any kind of academic problem, any kind of neurodevelopmental problem we have, or neurological problem from birth to old age. Executive functions are really compromised and affect daily life, and they are probably more than IQ the best predictor of success in life. So if your executive function or my executive function can be better if we sleep better, and that of any child, whether they have Downs, whether they were born prematurely, whether they're a normal, typical child, I think we need to really get going on this. And it's kind of, I don't know how to do that. I'm hoping that with my group, we have a group of professionals, the Western Canadian Association for Infant Mental Health, that's my other role. We have, in that group, we have an interdisciplinary group of professionals and hope to kind of emphasize that amongst the maybe pilots and some of the materials that Autism was talking about, you know, just those quick ways of screening sleep, not just for populations where the children are at risk or have neurodevelopmental disabilities, but really across the entire population. I always remember a few months ago driving down Oak Street to Children's Hospital in the morning, and I saw a big sign on the community center, and it said, all parents of infants sleep training, you know, on the weekend, this course, and I thought, oh my gosh, you know, who's teaching it and what are they teaching? It's a bit scary, actually. We need to get really together with the pediatric knowledge, the knowledge of the healthcare professionals that do the research in the area, to start giving parents consistent and really good information about sleep for typically and atypically developing children. Thanks.
Thank you. As I listened to the panel, I'm struck by, we've talked about the enormous impact that sleep has on the family, the stress that it brings, yet it seems strange that we relegate the topic of sleep to the privacy of the family and are either unable or unwilling to look at it. So I'd like to invite Dr. Lori Canning back up to ask a question. Oh, sorry.
Oh, I thought you were asking.
Sorry, we were trying to do this on the fly here over here. So perhaps rather than that after the panels heard from each other, do you have specific recommendations moving forward? They don't need to be research based or well thought out at this point. But what do you see as perhaps the top priority within your community or your perspective for moving forward with finding solutions to address some of the needs that you've highlighted? And perhaps we can start with you, Dr. Reynolds.
Oh, of course. Yeah, that's an easy question. So one of the other comments about the multidisciplinary interdisciplinary approach to the problem is actually a very good step in the right direction, because we are again largely talking about the question of awareness, and the more people are aware of the issue, the problem, and its consequences, will bring in more people into helping to solve the problem. I approach this from the perspective of a scientist, of a researcher, but also as part of a network of researchers which has linked me with other people working in the field in different aspects of the question. And it's when collectively we all come to recognition that we have a common problem, then we bring much more in the way of resources and different thinking to solving the problem. So from my perspective, it's a question of promotion and awareness to engage more professionals with listening to families, listening to what their problems are, and then seeking solutions.
Thank you. Dr. Petrie, Thomas, you already started off with some good suggestions about how you were talking about implementing some of the new tools and that Dr. Sobu is working on. Aside from that, are there other sort of avenues that you see as being appropriate?
Well, what I got from tonight in terms of you know, my own interest in my own area of research is I would really like to look at what's out there in terms of the link between executive functions and sleep, because that executive functions is a hot topic, and it's a hot topic in the schools. You know, 5 years ago, you would say executive functions, people didn't know what you're talking about. And you still need to define, you know, it's an umbrella term for a lot of sort of more metacognitive, higher order abilities, like being able to inhibit distraction, being able to initiate, being able to anticipate, plan, organize, use working memory, all of those kinds of things that help you manage your abilities. And so if you ask somebody, you know, people 5 years ago, they didn't know what you're talking about, but now more and more, you know, you hear teachers talking about executive functions training that they're doing with their kids in their grade 5s and so on. Well, I'd really like to see some work in this area, because I think that if you bring the two together, it's kind of like that, you know, whenever we have daylight saving and put our clocks back or forward, you know, they always come out with that research in the newspaper saying that, well, you know, the number of car accidents went up today because most people, you know, lost their sleep. Well, duh, yeah, that's because their executive functions weren't sharp enough. So, you know, that, I think that is sort of what, beyond what I was already thinking before I came, which is, yes, I already think we need to get into some kind of quick screeners that can be used by all healthcare professionals across the board, in community physicians, in hospital physicians, and so on, with all the all the childhood populations, just to catch sleep problems. And there are some lower level kinds of things that a lot of us clinicians can do that aren't the sleep experts, but that can sort of put in place that maybe can improve things at a certain level, and then a referral process where you can refer on to the next higher level to somebody who knows more than you do about sleep. And so I think that's a good approach to sort of be looking towards. But unless it becomes a priority in the healthcare level, you know, it's not going to be. So you got to think of ways how that's going to become a priority with the health authorities, I think, or the mental health clinics and so on.
I think one interesting relationship to executive function is that when parents aren't getting enough sleep and they're under the stress that we've talked about, they're honestly not functioning too well either. And so I know so their executive function goes down, and I can talk about that from personal experience. But when we look at it from ecology, like we were talking about earlier, and some of those external supports, I think it is important to recognize that it's global and it's ecological. Which brings us to Wanda. I'm interested in the parent-to-parent resource network that you're part of, and how you're supporting parents from a parent advocacy perspective, and some of the strategies that you're using that you think would be applicable in this situation.
This situation in particular, it's our group is a cross-disease support group, so there's a huge amount of variability in actually the different issues that we are addressing in our organization. So I can't actually answer the question very well on that one. But in terms of some of the things we were talking about, having people pick up on executive function, and actually Christine was mentioning giving sort of functional analysis of the family situation. Well, my daughter had about 185 lates to school because that's the way she sleeps and then wakes and then falls asleep again. And I was really glad to hear Karen's feel a slight amount better for allowing her to go very late to school on most days of the week, because that's what she needs. But I mean, if anybody was paying attention, they could say, does your child have a sleep problem? I mean, anybody in the education system could pick up on that, but it goes back to what I think we've all been saying, awareness, and both from the parent perspective and, yes, the wider community, and that does include school, because our kids are, well, like my daughter often falls asleep, either she's late or she's on time and falls asleep at school, so we have, the executive function of learning and being alert and all that being effective, but the awareness isn't there for anyone at the school level to say, maybe we should help you, maybe we should, chat and let's get together. So the big picture is definitely missing.
Lori, not to skip over you, but I can't help but wonder in the back of my mind, John's perspective on this, just being involved with educational programs. Now, I recognize you're not part of the education system, but working within education, how do you see this as fitting in? And educators' role in both screening and awareness promotion?
Well, I love what's been said so far. Awareness key, and having a general understanding of basic sleep assessment, if there is a problem or not. Something that the healthcare professionals should all understand, something that educators could do, something that any frontline professional would be comfortable doing a simple screening. Questions of the parents, questions of teachers, and getting to the fact that there might be a sleep problem, and then referring up the line. And it's going to be a catch-22, because if families aren't aware that sleep is a problem, and chronic sleep deprivation is obviously a significant problem, then they're not going to push the healthcare professionals to do more assessments. And if the healthcare professionals don't understand that sleep can be a problem for these children, then they're not going to push further. And if they don't understand the basics and they can't do the assessments, I mean, it's all a catch-22. I loved Christine's point about having all the ministries involved, because it's not just one, and they're very good at saying, you need to talk to so-and-so, or you need to talk to so-and-so. But there's supposed to be this multidisciplinary approach amongst the ministries themselves, so let's get them all talking together.
Laura, you've been particularly effective with IDIC 15 in the short time that your group's been organized in both rallying and communicating. So do you have some suggestions on how to attack and promote awareness, especially considering that parents are under such stress and often that sleep isn't prioritized because they're more focused on daytime behaviors or other medical concerns?
I think, it's building on what everybody else said, and the findings that Kelsey presented earlier as well, talking about how families have a great need to be acknowledged and validated in their concerns and in their advocacy. So I think as well as cross-institutional awareness and multidisciplinary teams, we really need to incorporate the role of parent advocacy. Parents need to have the tools in order to have their advocacy recognized and legitimized in the medical community. I think especially when you have a child with multiple complex needs, your expertise in that child is not often validated when you are seen by a siloed system that doesn't make the connections themselves. So when you bring them forward, like, is this connected to this? You're often met with sort of, you're dismissed a lot. So I think empowering parents with awareness and the tools to bring forward to their schools or their healthcare professionals is particularly effective. And focusing on, we've often had conversations with each other about functional assessments being more valuable. And I think if you want parent advocacy to be meaningful, many of the parents are not involved in the system or don't have the expertise or language to move those things forward. But what they do have is an understanding of how all of this is impacting their lives, and very deeply, and approaching it from that point of view, allows people to have a voice and power in moving their situation forward. So I think, in terms of bringing things bottom up, not forgetting that it's fine to have all of these plans and ideas and concerns, but if it doesn't really meet the functional needs of the families you're trying to serve, then you're missing an important piece of the puzzle.
Christine, you work with a lot of families one-on-one and have an opportunity to see what those day-to-day needs are. How would you suggest supporting families in advocating and both recognizing when there is a sleep problem?
I think it all come back to the awareness part of it. And my work experience actually involved with supporting a lot of the ESL family, immigrant family, because I actually moved to Vancouver back in 2005. And I think as Dr. Karen was talking about, different culture has different point of view about how many hours your child actually need to sleep. A lot of the Asian parents actually don't think the child needs like 13 hours sleep. Are you kidding me? They just can't believe that. So even for typical children, they're putting a lot of pressure on the typical children to work, to learn, not to play, not to sleep. You need to focus on the academic. So that's another awareness piece we need to focus on. That's why I was talking about the Ministry of Education. You need to go through channels through the school and let the parents know that this is actually affecting your child's behavior at school. The sleep problem, you're not giving them enough sleep. So that's another point of view.
Dr. Sobu?
I think we are confronted with a conundrum. We know the impact on the family. We know that information is not spread out in an orchestrated way. Awareness is missing. And we know that there is an impact of chronic sleep deprivation on executive functioning and on the brain, on the developing brain. And we are repeating that, we are confronted, there's enough literature about that, but we are not moving forward. For the last 5 years, we haven't been able to move forward, and I introduced myself to Dawn actually 8 years ago, and basically the population with Down syndrome needs really not only a screening but assessment, and many of them need CBAP therapy. We are still speaking about it. People who could provide it don't have the training. I think we are trapped. And in such a situation, when I get upset, I tell my medical director I'm going to do a hunger strike. And she most probably thinks that I will lose weight and that will be good for my health. But the key point is, how do we get over these barriers and out of this stuck situation? And I think before we continue and ask other professionals who are working in this area, I would love to hear, Lori, your opinion as an ethicist, how to structure this discussion. Tomorrow, Vancouver Sun is going to send a reporter, and should we go and say, this is a major issue, blah, blah, blah. We are doing adverse drug reaction, we are medicating the kids inappropriately, and we are observing the adverse drug reaction. Should we go this direction? I'm not very convinced from that. Can you help us? Can you really help us, coach us?
I wish I could, Osmo. a very big, very complex problem, you know. I mean, some of the things that I'm just hearing today by the panel members is that until people heard some of the presentations that have been given, the awareness, if I understood correctly, amongst parents and so forth, that sleep there's a sleep disorder that affects these other ways, other behaviors and so forth. It's not widely shared amongst parents. Everybody's agreeing with that, okay? So I think before we can, you know, cry wolf over the medication stuff, you know, we need to bring the whole level of discourse around sleep and the need for better understanding around sleep and sleep disorders and so forth into the public realm. I know that's not quite getting at what you want, but...
No, I think there is a fact. And the fact is, after knowledge, gaining knowledge is a long endeavor. Proving knowledge, proving facts is an endeavor. After getting approved that it is an evidence-based therapeutic concept, till it gets applied, it takes still 20 years.
Mm-hmm.
So we are confronted with a major issue, and we are watching and seeing what happens, and we know what we heard from the panel.
Mm-hmm.
Awareness is missing. Basically, it is missing in the health authorities and in the ministries. It's not a priority. So how should we deal with it? I feel myself challenged. I feel myself really challenged. But I have a conflict of interest. I'm interested in moving the agenda forward.
Mm-hmm. Mm-hmm.
I just had a thought where I'm not sure, with a lot of disorders we think about typical and atypical, and with sleep not being my area, with me sort of being on the side of it from other perspectives, I'd like to know what the experts here, Osmond, Karen, Wendy, people that do specific research on sleep, whether we're talking about children with neurodevelopmental disabilities that have particular, I think Karen gave us very good data on which syndromes were associated more so with which kinds of sleep disorders and parasomnias and various kinds of behaviors. Is it a continuum or is it a classification thing? Are we talking about sleep as a spectrum? Being this is your typical versus this is your really disordered atypical, and then there's stuff in between. Or I mentioned the sleep issues and my interest in it to a developmental pediatrician whose work I greatly admire. And I said, I really think this is a wonderful idea to do sleep screening. We all really need to be doing this, et cetera, et cetera. And she said, well, from my perspective, it's really just a group of kids. It's a small group of kids that have, the kinds of children that Karen was describing. And she described, in a very sort of nutshell, your triangle there. So, I think if we can establish that would be sort of help me know which way to go. There's sleep for the big picture, larger world, and then there's sleep, for more atypical populations and so on. But Wendy, go on.
So I'm Wendy Hall, and I'm a nurse. I'm a professor of nursing at the University of British Columbia. I've been working in this area for over 10 years now, and I've done lots of work with Osmond. I'm not as depressed as Osmond is. And that's because I've been chipping away at this for a long time. I go out and I've done many presentations with the infant development group on sleep, talk to them about some of the behavioral problems that can arise if children are chronically sleep deprived or have fragmented sleep. I've developed screening materials for the public health nurses. I've developed a tool that the public health nurses can use with families to raise their awareness about what is normal sleep and what should we expect infants to do around sleep, and they're using that in their practice. So I don't see this as an insurmountable problem, and I don't see it as something that we can't make headway on, but I think it's the kind of thing that you chip away at. And I agree with what you said earlier. We've got to raise awareness generally in the community about the importance of sleep for all kids. And it's even more important for kids who have neurodevelopmental delays. But until we get buy-in by the larger group out there about the importance of sleep, the really vulnerable groups are not going to get the attention that they need. And
So you see approaching it as a continuum
yeah,
be more effective than fractured groups like the typical versus.
yeah.
Yeah.
Because united we stand, divided we
Yeah,
fall.
right.
You know, and so I think we have to figure out a way as a group to get together and say, right, what do we need to do to get the community paying attention to what's going on in our world right now around sleep and the terribly devastating effects that has, not just on children but on families. I've worked probably with over 700 families over the last 10 years or so, and they can barely talk to me because they're so sleep deprived when I'm trying to help them with the problem. And I have to repeat things 10 times because it takes that long to process it. So I totally get what's going on out there and how difficult it is for people. But we have to start somewhere, and that's where I would start.
I'd like to add, like, how I've seen it worldwide. I think there's 3 points. The first point is, and that's also, in my country or where sleep is considered as not important. You need to do it, it's a waste of time. That's a big misconception. Okay, that's the one hurdle we have to deal with. The second hurdle we have to deal with is that in children, they outgrow the sleep problem. And there's some literature about that, and even though there's like 25-30% of the children with a sleep problem, there's about 10% that has a sleep problem as an infant and will have it as an adult. So that is a small percentage, but it is there. And if you don't sleep well, the impact is there. So children outgrow, but not all children outgrow it. And then the third, and that I think has been the biggest hurdle, and that's what I'm trying to advocate worldwide, is that we all, any profession, anybody, even parents, as I said, the first word, the first smile, solid food, the walk, everything, we're so biased towards daytime behavior. We're so totally biased on that daytime behavior, and we just simply forget what happens at night. And those are the 3 hurdles, I would actually drill on, and that connects everybody, and even non-sleep researchers, reporters, anybody will recognize that and will start questioning it. And then you just see as a continuum, that's also why I put them and circled them, I kind of initiating, maintaining, but in my previous slide, I also circled it. It is disorders of initiating, maintaining sleep, and disorders of excessive somnolence. That's a top complaint, and it's not only that we see in children, but it's also the parents that will actually come. So we have a society. It's a societal problem, and that is something I think it's gradually. The knowledge is gradually pushing, towards the media, and it's becoming cool, all the apps on your phones, it's becoming cool, it's getting into the market, sleep. And I'm just hoping as a sleep researcher, that's getting into the market in a good sense and in a bad sense.
Yeah, I think I'm worried about it getting in the market for mothers of very young babies, thinking their babies need to be sleep trained, from too young an age.
Yeah, and what we also see in sleep research is now we go into pregnancy and sleep during pregnancy, and how that actually influences and ways, to go with Sleep2Treat angle there. So it's a young field, but only when you open up and you address it, even though the professional is not addressing it, when you address it, that is actually how it just whittles around. And then, as in China, it is indeed, I sit at the table with the Ministry of Health, Education, director of hospitals on how can we help children that are in the children's hospital to sleep better because we work on help their recovery.
Hi, my name is Andrea. I am a clinical sleep educator with a home care company, specifically dealing with adult sleep, but I have been in sleep for 16 years, and I've worked a little bit with polysomnograms in children. And one of the things I think we have to do too is we have to combine typical and non-typical, because typical children that have sleep problems can pose as a non-typical child with developmental problems. So if we can treat their sleep, we may actually improve, and they actually don't have a non-typical problem. The problem I'm finding is education of the GP. The parents may go to the doctor and express a sleep problem, but it's got to be the GP that recognizes that there's a potential sleep problem. Part of my job is going to GPs, or our company, we have marketing and go to GPs to educate about sleep with adults, but we can't educate about sleep with children because once that GP identifies a problem, there's very few people to send them to. There's Osmond here, there's a children's lab in Alberta, but you're looking at a 14 to 12 month wait list to get them in to diagnose them. Then what happens? You've now got a child with a recognizable sleep problem that's got to sit for 2 years before anything happens. What if that causes more severe health problems because of a sleep disorder? So if we can somehow get them treated in the community, get them started on a program before they're even seen in a sleep lab. That's what we do with adults. I'm not saying we do it, but it could unload a bottleneck that could fill up these labs that unnecessarily. For example, with adults, we do level 3 screening, a little home test they take home to distinguish if they have sleep apnea, and then they can be treated in the community and never go for a polysomnogram. As long as their symptoms improve and their health improves, we've treated the problem. If there is something else that's going on, then they're routed to the polysonogram. I know in Alberta, the children's sleep lab there is about a 12-month wait list. So what's happening is they might see a sleep physician, and the sleep physician pulls a number out of their hat and says, here, try CPAP on 10. Then they send them to the home care companies, and we try and manage them and get those symptoms resolved before they go back to the sleep lab. And then the sleep lab may then say, okay, well, maybe they only need 6, or maybe they only needed this. But then you've got different sleep doctors that says, well, an apnea, hypopnea of 1 in a child is abnormal, and yet they're treating a 17-year-old the same way, because that 17-year-old's a child. So there's a lot of issues. We can educate, but where do we send these kids to? Because no parent is going to want to sit for 2 years with a diagnosed sleep problem from sleep assessment, but nothing's being done. I'm a firm believer that there must be something in the community we can do for these kids. I have GPs, I'm from the island, I have GPs now that are sending us, they're doing level 3 testing on adults, we're getting level 3 testing on kids, they're begging for it. So we've got some doctors that we're getting educated that are begging for the test, and I've got my accredited sleep interpreters of our adult test saying, I'm not touching this. Because if I diagnose a problem, where does that child go? Who's now looking after that child? Who's responsible for that child's care? And I think that's where all of a sudden it's just medication run. I go for comments.
Hi, my name is Jennifer Garden. I'm an occupational therapist. And for some of those very reasons that she mentioned, we started a company addressing sleep because I find many people don't actually know what OTs do. So maybe I'll just humor everyone and let you know what we do. So as occupational therapists, we really assess and treat activities of daily living. So our term occupation is a bit of a misnomer because what we think is occupation is actually everything that we do to occupy our time. So I liked Christine's comments. I think we're working in silos, and I'm happy to report that the textbook in OT is now, it has a whole chapter on sleep. So we're getting our healthcare professionals more up to date with what this is. Working in the area, specifically with children and infants, what I'm seeing is there's no place to send them. I'm identifying issues, and a lot of the times I'm looking at it from a sensory integration perspective, which we're actually picking up a lot of for typically developing children as well. And there's some really good evidence out there for adults and school-age children. We're actually replicating the data research with some occupational therapy students at UBC, so I'm hopeful it'll come out with the same findings, because clinically that is exactly what I'm seeing. The problem is so large, and I really feel that it's a community issue. And if you think of participation in the 80s, about getting moving and everybody needs to get more in shape and fit, we need to look at it, I think, from that global perspective and engage the entire community. And you look at Australia, and they have drowsy driving campaigns, and they have ads on television, wondering, gee, should I get behind the wheel? I'm really tired, my baby's asleep, do I really want to take them out of the vehicle? So they have some lovely, heart-wrenching ads to make you actually start to think, gee, you know what, maybe I shouldn't be getting behind the wheel, just like we do for drunk driving. So bringing it to that community level, community awareness, and it's a multifactorial piece. As an OT, I would love to be able to send, I have a child who doesn't have a quote-unquote diagnosis, and there's no place to actually send this child, and I know they have, a little bit of this, a little bit of that, and there's something funny going on. I talk to the doctor, and they're asking me advice because they actually don't have any knowledge in sleep whatsoever. So we are working in silos. The community level isn't up to par, and I think, we have a lot of work to do. I'm really excited that there's this many people here. Because some of the conferences that Osmond has had, there's been, fewer and fewer people, and I just think it's really nice to see this community come together. I think it's possible. We need to push forward, and lots of letters maybe to Health Canada.
My name's Cox Daniel. I run a sleep company as well that treats adults with sleep apnea, but recently we've been working with Osmond very closely with some of his pediatric patients. And one of the things that I've noticed, and I think having a little bit of experience in both the adult and the pediatrics, is that it really has to start with the grassroots of just the simple basics of sleep. I think if the whole adult population doesn't understand or recognize the importance of sleep in its basic form, no matter how much we talk about specific sleep disorders, whatever they may be for adults or for pediatrics, I don't think the culture will change. And talking, with what Karen said, we do have to almost infuse a new culture of what sleep should be in the community. And I think Jennifer mentioned, having these ads and things like that. I think it has to happen. But it shouldn't even happen in the way where it's individualized to particular companies or things like that. I think it really has to come from the provincial government and promoting sleep. And once you start from that, it may be 20 years from now that we see its fruits, but we have to plant the roots somewhere, right? Plant the seed somewhere. And once you start to do that, you could start to layer on things, awareness days. For example, we can have an awareness month where each foundation or group, maybe the Autism, Foundations for Autism, Foundations for all these things, will start to now put ads up for their particular interest. And then it becomes this whole snowball effect of how great it is to sleep well. Whether or not you have a sleep disorder or not, I think people will start to recognize that sleep is important, period. And once we are able to establish something like that, however we can establish something like that, I think that's a good starting point for us all to start to educate, whether it be the medical community or the educational system or even our own families. Because One of the other things that I've noticed in starting to deal with the pediatric population too is that the tolerance that Karen had mentioned, there is a great tolerance for sleep disorders. And I think it's because, again, it's not important. It's not as important. Even though they've approached to try to manage a sleep disorder, once the first obstacle is there, you almost say, well, it didn't work, so let's just forget about it and try something else and figure out another avenue. But if sleep was truly important from the start, it wouldn't be that way that easily. They wouldn't give up as easily. So that's just my tip.
Hi, my name is Ian Boyle. I'm one of the senior technologists in the sleep medicine laboratory at Sir Memorial Hospital. I also do some work out at UBC Sleep Disorders Laboratory as well. I also have now a 23-year-old daughter with Down syndrome. My daughter first got her tonsillectomy done when she was 3 years old with sleep apnea and then went on to CPAP. She just graduated from university. I come at this from, I've been doing sleep medicine for 24 years. Education has been a long, drawn-out process in the adult community. Unfortunately, you may find you're going to go through the same thing in the pediatric. But unfortunately, we can't get kids to go by themselves to talk to physicians about sleep disorders. So it's the adult population we've got to go after. Make sleep important to them and make sure that they understand that it's important for their children as well. I also spent some time working in New Hampshire in the States, where kids were starting school at 6:30 in the morning. Kids in rural communities were getting on buses at 5:30, and teachers were wondering why kids were falling asleep, with no understanding that circadian rhythm of a child and a teenager, they don't want to go to bed until 11:30 midnight. And I had a school board member tell me they're just lazy kids. It's disgusting what's out there in the community, and the education part is paramount that we need to get this message out. I'm going to touch something that I heard that got me off my feet. I am not a proponent of level 3 sleep studies. They're nocturnal breathing tests. They do not measure, and particularly in a pediatric population. In children who have sleep apnea, you do not get a desaturation. You get an arousal at the end of the respiratory event. A level 3 study does nothing to measure an arousal. And the arousal is a disruption of sleep, particularly in the pediatric population, is the most important factor. Desaturations, most even 17-year-olds will not desaturate with an evaluation of sleep apnea. A level 3 study has a correlation of about 40% when an adult has severe obstructive sleep apnea. They're not that great a screening test. They're just something that's there to placate certain people, and I'm sorry, it's also a way to sell CPAP machines. The other area that's going on in the sleep field is that the respiratory part is driving the whole thing, because that's where money is to be made. The issue in the pediatric population is much more than obstructive sleep apnea, it's sleep disruption. And getting more facilities that will bring children in. I've done a lot of work with Autism. We now have my own medical director who will take children above the age of 14 into our sleep lab at Sir Memorial. The only reason we don't want to go younger than that is we don't have the expertise in dealing with it. There's different brainwave patterns in children under that age. The brain hasn't fully developed, so when my technologists are scoring the records, they don't have the expertise to recognize the different sleep patterns at those ages. So trying to expand the pediatric group in sleep, there's a huge movement in the technology population to try and expand pediatric sleep, again driven by our colleagues south of the border, and I'm only hoping that it will slowly progress a little bit north here as well. But keep up the good work, and if anybody wants to contact me, feel free to do so. Okay, thank you.
I'm just wondering if the field of sleep generally, sleep disorders and whatever, can learn from other public health initiatives. Like, I'm thinking about some of the other public health initiatives that have aimed to increase public awareness about certain kinds of things. And would those strategies be useful to adopt? I was in Toronto. This is a small example of one that I thought was quite interesting in terms of trying to make parents more aware of the developmental stages of their children. And I was just on public transportation, and this was put up by Public Health of Ontario, whatever, and it said, you know, something to the fact, by 18 months of age, your child should be able to, you know, show affection, or, you know, there were a couple of different things, speak 5 words, and I think there was just maybe one other point. And if your child, you know, hasn't, you know, attained these goals, but it was very gently said, so it wouldn't make you know, parent fearful, I wish I could remember the language, you should go and see a public health nurse, or, you know, that kind of thing. And I'm just wondering if you tag on the sleep bits to those kinds of public health messages, might that increase the awareness both on parents and ultimately on providers about the importance of sleep, so that everybody starts to ask those questions, rather than making the whole sleep thing something unique in itself?
Within the developmental model, yeah.
Can I just comment on that as a parent? I know one thing that was probably the biggest obstacle and the hardest thing to struggle through as a parent of a child with a sleep disorder was the shame and feeling of responsibility. And I think if there was greater public awareness, that some of that personal accountability, that blame that I felt, I think that I could have coped better with it. So as a parent, I think I can strongly advocate for a public health initiative that normalizes sleep disorders, normalizes the difficulty, and provides options that says it's okay to say that your child's not sleeping. Because when you're in that mommy group, you're not putting up your hand to say, my kid's not sleeping through the night. Yeah. Did we have a question over here? I'm mindful of the time.
I'm just going to make one. Sorry.
Please, I'm not just putting any brakes on.
I just think I'm a respiratory therapist, and I think it's just the real world application that everyone's saying, well, we're going to do this and we're going to do this, and years from now, and we're all working towards that goal. But something struck me with you know, most kids go to school, right? And even if they have a sleep disorder, and I think teachers could be such an integral part of this whole process. And the kids at our school, they have a project. They have an environmental project or a green project, and a real world application that you could apply next month. One pilot school in wherever community. Yeah, example, our school, our elementary school. I have a bit of a sleep background, and so why can't you do the polar bear card or some basic assessment training with the teachers in the school? And if they accept that school, you'd have to maybe legal processes with the school board, but why can't that be like a right now process of a screening tool that could be implemented into the school system, which is really, all the kids go to school. And that's, I think, the real world application. You're looking at not a solution, but right now, to introduce it into the awareness, is that might be something that you could look at even as a pilot project, and having UBC be a part of that with the school board and the school system, like now.
But the Ministry of Health doesn't take it up. Maybe the Ministry of Education would.
Yeah, and that's what I mean. I mean, and then looking at the global initiatives and the competitiveness and IQs and competing with other countries. I mean, that's not what we're doing this for. But if that's in the guise of getting some funding, maybe that's something that can happen like now, not just like, well, yeah, we should and we should and we should. And it's all well-natured, but I think the awareness in the school system has to be even the simple awareness that snoring is not normal. All these commercials that are, well, that's a good sleep. No, it's not. It's actually partial airway obstruction. So, having that awareness, something basic that your kid shouldn't snore. Technically, it's not normal, really. And then that will cue in some questions, and then they'll take it home to the parents, and then maybe it's a suggestion maybe.
I think the teachers would be really on board, because I know when my daughter hasn't slept, her executive function is in the tank, and so I'm sure I agree that that's a great strategy. We have a couple of questions coming in through the web, and I think after that I might ask Dr. Ipsodo to come up, and we can just have our final comments for the day, and then I think this is a great springboard for moving into tomorrow. The first question is around communication. Do you agree that we should educate the general public about the importance of sleep before we can narrow the focus on specific sleep disorders in children as well as adults? I think that we've already covered this quite a bit, but does anybody have any final thoughts or comments just to conclude that?
I was just going to say, I mean, we've got all these wonderful, talks about whenever you're in healthcare, it's always from the atypical point of view, right? And what we don't have amongst our group, and maybe what we need is sort of, the benefits of sleep just from the positive point of view, where people, after hearing those kinds of things, would say, well, I'm going to go home tonight and get a good night's sleep. It would become more sort of desirable or, socially showing that you have good self-care. I don't know. I mean, I just think we're always coming at it from the medicalized things, from the problem-oriented point of view rather than, it's like health promotion versus,
Go ahead.
Okay, I just wanted to add, we talk a lot about communication, but depending on our target audience, it's going to be a multi-pronged approach. What's important to one group is not necessarily a priority around sleep for another. I mean, if you extrapolate everything to the general population, just think about our own personal circumstances around disordered sleep. What is the impact to how my husband and I function in the world when my daughter is going through disordered sleep? What was the impact on our income? What was the impact to our employers? What was the impact to our health and to the system? So it's not, we talked earlier about the spectrum of being a small population of people. It actually affects a large population of people in very different and diverse ways. And I think if we're going to look at how we're going to approach that in a public health perspective, we need to really recognize, there is a multi-pronged approach we need to take with this. To the Ministry of Transportation, like, what is the impact there? What's the impact to ICBC for people having access? So it is so pervasive in our society that identifying like the real societal costs of that, I think, is impactful to different groups. So, you're right in saying that the understanding how it impacts people and normalizing that in the community is going to be a big piece of that. But at the end of the day, who's accountable to making that happen? How will we pay for it? How is it distributed? What's the sweat equity involved? It's a huge undertaking.
Lori, you have to speak up.
Oh, I'm sorry.
You have to speak up. People from the webinar are saying they
I'm
don't
too
hear
loud.
you.
Sorry.
Not too
Yeah,
loud.
I think what I was saying is more or less, we need a multi-tier, multi-pronged approach throughout our society, both for atypical, typical people, for people involved in the healthcare system, and people just in the general public. But we need to identify sort of, how we're going to do that. I think that's a big question.
So, this is maybe a funny statement from a scientist, but the question of who should be educated, the general public versus special groups or targeted, I really think we have to demedicalize this entire conversation. This is not my problem or his problem or her problem. It belongs to all of us. And I would use statistics. Really, 1 in 3 kids doesn't get healthy sleep, at least. And what does that mean? It means they don't do well in school. Well, we all know what that means. This is the type of conversation that we really need to have to raise awareness. You'd really like to have somebody famous get up, and make a commercial. Well, we're Vancouver. Get one of the Canucks. I don't score if I don't get sleep. It really is about that. I've actually just had this conversation several times in the last couple of weeks about how poorly we as a group, I'm looking at the scientific community who generates all of this knowledge, how poorly we actually communicate it to the people who can use it. So I'm starting to talk with people who do communication for a living and have them teach me better ways to communicate ideas and concepts that will actually have an impact. So yeah, we need to change the way we talk about things and who we're talking to if we really, really want to evoke a societal change.
I wanted to make a comment, but I think there is nothing to add. We have really to demedicalize it, and that's the point. You're absolutely right. And the problem was that we had medicalized too much possibly in between, so we have really to communicate what is norm, what is not norm, and also respect the cultural background issues. There are completely different cultures. In certain cultures, co-sleeping is considered completely in a different way. We have to respect that.
But I think across the board, there is a recognition that sleep will not be attended to until there's a medical crisis. And I think that that's important to recognize. I'm glad that you stepped up to the microphone because I think our last question might be directed towards you. In what way is this sleep onset latency related to the quality of sleep?
It has always been a good predictor of sleep quality and sleep duration. So it's one of the first things sleep researchers will ask: how long does it take to fall asleep? Again, it's a difficult question to answer on what we would expect for a child. So 20 minutes, half an hour, for example, children with ADHD are known to have a very long sleep onset latency. So it is a very good predictor, very well known. It's the only thing that I'm advocating for is the sleep offset latency should be questioned as well, because one cannot be seen without the other one. Okay, to describe how good the sleep was in terms of quality and quantity and regularity. Okay. So I would like to come back to the other point. So since sleep became a little bit popular, because you have to consider that sleep has always been conceived as or perceived as not cool. You know, it's more cool to say, oh, I just didn't sleep one night. I stayed up all night, or I can manage with 2 hours. Especially when you're a teenager, it's cool that you can say that. But I think the fact that shift working popped in, and aspects such as Chernobyl popped in, and then what I now see, and what is quite popular in Belgium then, because we're good in cycling, is how we can improve, and maybe that it's a good side but also a bad side, how can we improve of the professional sporters in terms of their sleep, because they travel also and they need to sleep in different beds. So that's another venue, another area that will sneak into sleep, maybe not for the good, maybe for the good, who knows. Also the army is very interested in sleep, so you do see, to increase performance, to increase, making a sharp decision at the right time, so executive function and attention. So there's things ongoing, so hopefully it just keeps on growing in that sense. Okay.
My name is Les Matthews. I'm a professor of respiratory therapy from Carleton University in Kamloops. Just on the topic of whether we should go bottom up or top down, Osmond and I have worked with one of the elementary schools to try and work towards education from that point of view. We've had discussions with school boards with regards to that. We've been on the radio, CBC, on and on and on and on for a long, long time. And I sympathize with Osmond's frustration because I think part of the problem is there's so much information out there, and it's coming at us, all of us, professionals and parents, so fast. And I think it's really frustrating for everyone, because until you get pressure from someone to go read one of the million bits of information that hits us every day, you don't do it because we're too busy. Our lives are just too busy. We've got too much going on. And so I think that's the real benefit of us looking at using, for example, dentist's office for screening purposes, because that's where most kids go. That's where most people are going on a routine basis. Strategies where we talk to the school boards and we try to get sleep as one of the three main pillars. At fitness, they're hopefully going to refocus on that. diet, they're hopefully carrying on with their efforts there, and sleep as being a major issue for health in kids. And so if we can work towards the school boards bringing this in as a major issue in our health, then that will put pressure on the education system, and that will get people to read the literature because it's there. Because when I hear people that I respect and I know are very knowledgeable in their areas say things like sleep apnea is not important in prenatal health, and that simply isn't true if you read the literature. Saying things like neurodevelopment and sleep are not connected to each other, that simply isn't consistent with the literature. It goes all the way up through all the different age categories. If you read the literature in each one of those categories, all the way into the elderly, I don't care, chronic obstructive pulmonary disease, congestive heart failure, hypertension, there are so many places where sleep disordered breathing and restless legs and just all the different, over 80 different disorders in sleep cause problems, cause comorbidities within health. I just think that the only way we're ever going to get there is by educating the public, by getting people to understand that this is something they need to put pressure on their politicians, they need to put pressure on the medical system to take this more seriously. Because otherwise, there's just too many things out there. There really is. And no one's going to pay attention to it because there's just too much stuff coming at us too quickly. So I think that's, Osmond's approach to try and say we should be going bottom up, we should be educating the public, we should be trying to get people to understand what a huge issue this is, all the way from newborn child to grandma and grandpa, is something that we all need to sort of be focusing on.
I agree with what you said. I think for us all to take this seriously, it also should be palatable and maybe fun. And I just had an idea that in my daughter's high school, their particular high school is known for their film and video program. All these film and video students are required to be public service announcements, and they receive money from ICBC for doing it. And the whole school watches their public service announcements. They're like 30-second clips, and they're smart and funny, and they get the attention of high school students. And I'm going to put together a little information and send it down to them. Because they're always looking for topics. A lot of them have been about drinking and driving and protecting valuables in your car. You wouldn't believe what high school students come up with on those particular subjects. They're just amazing. So that was great.
So can I just add 30 seconds to that? We've done several YouTube videos for that very reason, to try to get a message and get it out broadly. So if you get one done on sleep in kids, Osmond knows how to get in touch with me. I can help you get some national distribution. Yes.
James, I love always your comments at the end. Last time at the Peter Wall meeting, he stood up and said, okay, I like this discussion. You can analyze the 60 interviews. And we were thrilled, and then we were suffering among the 60 interviews. Yeah, we will go ahead, and we love to do that. I have to really correct now the wrong impression possibly I'm giving. We love to do that, and we have a wonderful poster which will be, you will get it as a present. I'm trying to put together my thoughts and would ask you to correct me. I think the question about sleep latency and your answer shows really Karen's answer, why sleep latency is so important, it has to be monitored. The concept of using logs and diaries which start already at the home level shows how much important information we can get from parents, and how a real assessment starts, and who the key partners are in communicating information. So we need to inform them. We need what we discussed before, a kind of simple basics of sleep, and focus on a change of culture that I have to confess that 15 years ago, not sleeping through 3 days at the intensive care unit, I thought that was quite adorable, man-like, physician-like activity. I feel very remorseful about that today. So we have to focus on changing the culture and demedicalizing sleep. We discussed several times, and I think if we speak of changing the culture, we have not to focus only on disruptive daytime behaviors. We have really to make a clear-cut statement. Medicating disruptive daytime behaviors without assessing sleep is inappropriate medicine. I think we have to come up, we have to agree at some point, and those people who communicate that have to take over the responsibility. I feel myself quite comfortable to communicate that. That's a goal I have communicated to mental health as well as developmental pediatrics. And we can show what happens with these drug therapies. I think what Rose Carlton highlighted very nicely, and what there was a wonderful discussion between RTs and companies about how we monitor treatments, how do we screen, how do we monitor treatments. I think we have again to ground the success of our monitoring with the parents' feedback. Is there a change or not? Within what timeline? Are other healthcare professionals who are involved, like teachers, teaching aides, occupational therapists, or speech-language pathologists, saying there is a change happening, or there is still a room for improvement, it doesn't really help, sleep is not treated? I think we have to think about our monitoring strategies. We don't have lots of resources, and we have to come back to all those who exist. And that leads to a new question. How do we deal with companies? And initially I was thinking companies, CBAP companies, etc. But I suddenly realized most of my colleagues have organized themselves in corporations. So we all have companies, and we all have really conflict of interest. So what we need possibly tomorrow in our discussion is to discuss the ethical framework of the in which we are moving. Without companies, we will never be able to move forward. Physicians have companies, OTs have companies, RTs have companies. Okay, that's fine. We are living in a world with companies, so let us discuss the framework and how to make it inclusive, and not only to expect from the state, from the government, to come up with the solutions. These are things I have picked up in a very biased or compounded way. I think tomorrow's discussion we have worked out a position paper. I will go early in the morning to the hospital, print it out. I don't think that I have to print out 200 times. I will print it out 40 times, and possibly we can continue this discussion in a smaller group. I assume we will not have 4 or 5 breakout sessions. We will have possibly 2, and discuss more on structuring the discussion and how the final report to the health authorities and ministries should look like. I think key is here to put sleep on as a high priority, and that should be also the message to the Vancouver Sun. James gave again a wonderful, I will ask Kelsey to write it down for me, one-third of our kids is sleep deprived, and if I don't sleep, I don't score, something like that. We should really focus on 3 or 4 key messages, and then enable the Vancouver Sun journalists to make individual interviews with those who are interested, and ask her what her goal is actually, of course. But our goal is very clear. We have to advocate for putting sleep on the agenda, and from various aspects. And I think what we did today is we brought not only healthcare professionals together, what we did for the last several years, and developed consensus papers. We have parent initiatives, service institutions, And the paper which goes to the health authorities has to be supported by them. If we get along, I think we might possibly change, and we will use for sure the behavioral adverse drug reactions and the numbers we have from my clinic in order to highlight the situation. That's what I'm getting. I don't know. Possibly you give me your feedback.
I see some sleepy eyes in the audience. I'd like to welcome everybody back tomorrow at 8:30. We'll have coffee to help with the latency offset. Please also, over the evening, think of a message to help support us with our Dear Ministry messages, as well as consider sharing your story at the Speaker's Corner tomorrow, which we'll have set up. Thank you very much for coming and spending your evening with us tonight.